Thank you, Dr. Puckgreen. And up next, we have Miss Malvise Scott.
I'm going to talk a little bit about those things that the Senator talked about, FQHCs. Entities that I believe to be a part of this change that's coming about. Just a little background. Health centers started in '65 as a demonstration project, just as this is doing. We have celebrated, or in the process of celebrating 50 years of service to patients in this country that lived with disparities and that needed care. I'll try to make it very brief. They are private, not-for-profit entities that are partially federally funded. Let me indicate that when they started, about 100% of the revenue in the health centers came from grant funds, grant sources. Now it's less than 20% nationwide in the aggregate. One of the things that made these programs so important was that they were community controlled and community directed. 51% of the members of the boards of directors had to be patient served by that center. The board had to reflect the community in terms of demographics, and that's still the case. It was some 10 years after 1965 that the program was moved from a demonstration to an ongoing program. And at that point, there were health centers across the country, but in very small numbers. The next big thing that happened that made them work over the long haul was President Carter's determination to have urban health centers and rural health centers. Let me just say parenthetically that the original health centers, except for the very early ones in the South and other places, were urban. There was a recognition that there was the need for care. There were disparities, whether they were racial or not, in rural communities, and that resulted in an additional 800 health centers coming into the mix to provide care. In 2000, I'm going to jump ahead, but let me just stop here because in this historical look, in 1988-99 was the advent of prospective payment system. It made a difference, and I'm bringing that up as a part of our history. It made a difference in how these programs progressed through the years. It's not the panacea for everything, so we need not think that. But it is important in terms of making health centers able to provide additional services, some non-traditional services, to do some innovative things, to provide some things that we call enabling services to help folks move through the system, not purely medical. It stabilized them and made a lot of things happen. The next big issue was in 2001, President Bush decided that there should be another wave of growth in health centers. And let me just say again, I'm calling health centers the corporation, the entity. His effort was to increase the number of delivery sites and went about funding it and doing it. To the surprise of a lot of folks, but it made a big, big difference. So during his presidency, 1,200 health center sites were created. Currently, there are some 1,300 corporate entities. Those entities provide services to some 24 million patients, 9,000 sites across the country. The disparities that we are able to address, both because of our history and the very kinds of things that made a difference in terms of the beginning of these programs, still exist. We are still making an attempt to address them. Of the 24 million patients that we are seeing, and there's some 90 million visits, 300,000 are veterans. Something that we have focused on over a period of time, but I will have to admit, more vigorously recently. Over 7 million children are provided care through these programs. 11 million homeless. 62% of our patients are racial or ethnic minorities. 75% are covered by Medicaid or are uninsured. And 95% of the patients have incomes at less than 200% of poverty. We know about disparities. We've had a history of providing care, and in my opinion, this is the perfect time for the two organizational groups to work together. We see some of these patients when they come out of prison. We see some of them, unfortunately, before they go in. It is imperative that when we work with communities, we look across the spectrum and see who can provide services. Let me just say that some health centers have provided care to people who have been released from correctional institutions all along. There are a number of things that can be done to strengthen the system such that both medical services are provided and behavioral health is provided as well. There are a lot of things that can be done together. It will not work. And by the way, we don't have 50 years anymore. It took us a long time to get here. We don't have 50 years if we want to address this. So we need to put this in fast forward, figure out what kinds of opportunities there are in communities to work with not just FQHCs, but with a variety of entities to make sure that we are addressing this issue. I dare say that the senator talked about how long it took to get this to happen. As the kids would say, we can't blow it. We have to work at it. We have to make sure that we are conscious of improving the system and making sure that people are adequately served.